Morning,
About
Serena.
Lee.
Excuse me. Sorry. A lot of talking this week. I'm losing my voice. All right. I see some people coming in. Let me see. Looks like, oh, I don't think any of them are our presenters. So we need to get our presenters and then, yeah. And then Shala will be here as your department support. So
Okay.
we'll give, hopefully, we start to see some of the others rolling in.
Okay.
Do you have any questions for me? Looks like you facilitated one as a room monitor a little earlier. So are you pretty comfortable with that responsibility?
Yeah, definitely. Hannah this morning didn't want to be introduced. She just wanted to just go on her own. So I just told her I was there to support if she wanted.
And I think Shala was actually in that one as well.
She
So
was. Yeah.
yeah. Okay. So you've got, and it looks like some of these coming over from the Lunch and Learn series. So that might be why they're jumping in, but we still have 5 minutes. So we have plenty of time.
Okay.
And I don't know this particular presenter, so I'm not sure what their preference will be, but certainly we'll let them decide if they want to be introduced. And I'm noticing a lot of the speakers don't seem to mind monitoring the chat either. So we just make ourselves available just in case, because I know it can get kind of cumbersome, especially if they're working on one screen to be monitoring chat and their presentation and want to see people. And so
Yeah.
we just try to make ourselves able to fill in, and fingers crossed we've had very, very few, let me knock on wood, because we still have the closing keynote after this. We haven't had a lot of technology issues with our Zoom rooms. People are getting in, they're getting in okay.
Okay.
They're not getting constantly kicked out. So it's been a pretty smooth running conference other than a few other blips on this radar, but we're good. So
Okay.
So I do hope. Let me check in. I'm going to go on mute. I am here. I just want to check in and make sure the other one's running too.
Okay. Sounds good. Thank you. Hello.
Hello, how are you?
Good. How are you?
Good.
I'm going to be here just to support if you need help with chat and anything like that. Would you like an intro or do you want to?
Oh, we can dive in. I
Okay.
am waiting on a co-presenter, so
Okay.
as soon as she jumps on, we can go right in.
Okay. I think did it already make you co-host?
It has not yet. I did not get the alert.
Let me send that over your way too.
Okay.
I don't see Katie in the waiting room yet.
Oh, she said she was waiting to be let in by host.
She is. Is she listed as someone else?
It should be Katie Bremer or Catherine Bremer.
We do, Tina Preet, we do see your name listed twice. Would it be possible that she used the same link you had?
She did because she did not receive a link when she registered.
Okay, so
And I just sent her mine.
So Serena, let the other Tina Preet in because she can change her name when she gets in. It's just they use the same link. That's all.
Okay.
Got it. Ah, I see. Hi. Katie, I know that we use the same link, so I think you could just rename yourself because you're named as me right now. Yeah.
Oh,
Katie,
I love being you.
that you're more than welcome to stay with the same name. It may be a little confusing. Katie, do you know how to change your name on the Zoom screen?
Yeah.
Okay, awesome.
Thank you.
Absolutely. So Serena is here as our room monitor, and Shala is here as our department support. So you've got two very capable and willing to help individuals here. They'll be doing just a real brief introduction, turning it over, reminding everybody about CEUs, monitoring the chat, any tech support that you might need. And then I will be bouncing back and forth between the two presentations, just keeping an eye on everything to see if anybody needs any help. But otherwise, I will let you guys get started. Thank you so much.
Yes, thank
Thank
you.
you.
Before we get started, how do you pronounce your name?
Tanupreet Suri.
Tanupreet Siri.
Tanupreet Suri. Yep.
Okay. Tanupreet Siri. Okay.
I didn't get the co-host thing. I'm still able to share screen though, right? And Katie, are you able to share screen if you need to?
I do have an option to share the screen if I need to, but I figured you would share the PowerPoint and
I can do that.
awesome. So exciting.
It has Dr. Crowley listed as the co-host, but if you want to test the screen now, and then I'll let everyone in whenever you're ready. Just give me the heads up when you're ready to go.
Can you all see this? I will put it in presentation mode. It's not in that right now, but
Yes.
Yeah.
all right. Let me real quickly. Got it. Okay, I'm all set.
Okay. And I know you already mentioned you don't want the intro, so I'll just let you go. If you want to, you can intro yourselves.
Katie, because that was part of our presentation was our introduction, so we can just. Okay, sounds good.
Admit's coming in.
Awesome. Thank you.
All right. I am going to assume this is everybody.
Welcome. Yeah.
Welcome, welcome.
Yes.
I'm going to go ahead and share my screen so we can get started.
Sounds good.
And then we will get into talking about who we are in just a moment. So welcome to Working in Tandem, a co-supervision model. we will be talking about supervising with other folks and how you might go about doing that if you haven't had experience in it already. And perhaps we may get into discussion of, if you have already done that, what that has looked like for you. All right. So introduction and group discussion. I'll introduce myself. My name is Tanu Pritsuri. I am assistant professor currently at Touro University, and I've been working there a few years. Katie and I, we'll get into this a little bit later as well. However, just plug it in for now. Katie and I have known each other for quite some time now, and we work together. We've supervised together. We've seen clients together. We've taken classes together. We've taught together. So we've done the whole thing. So my name, that's my current role. Just a little bit about Katie and I's relationship. We're also friends outside of our professional communication. A fun fact about myself is that I really, really love spicy food to the level of like food challenge level spicy food, just to throw that out there. So that's a little bit about myself. What is the current supervision model I use? I use the discrimination model currently, and have actually since I started supervision. It's the one that I'm most aligned with, made sense for me, and it's working for me still. And have I tried co-supervision? I have, and that is what has brought me here today with Katie, actually. As far as supervision, just to give you all a little background, I have done supervision in a clinic with students currently seeing clients, and I've also done supervision with practicum and internship students, which is what I currently do now. So on both sides of the clinical dynamic. I will turn it over to Katie, and then we can, you know what we'll do? Either you volunteer yourself once Katie's done, or you can put it in the chat, your own introduction, since we do have a lot of folks today.
Hi. Thank you, Tanu. My name is Katie Brammer, she, her pronouns, and I am currently a counselor educator at Southwestern College, which is a small private college in Santa Fe, New Mexico. I teach completely online there because I live in St. Louis, Missouri. And I have a small private practice where I see queer and non-binary youth and work with their families and individuals, couples, counseling. That's pretty much my role right now. I do a lot of volunteer stuff, but a fun fact about myself, one of my most favorite jobs in the whole wide world was being a short order cook at Waffle House. I absolutely love that job. And my current supervision model is I use the discrimination model, but I do find the structured peer group supervision model to be really beneficial when you are doing triadic or group supervision, which we're going to talk about today a little bit. And then, well, Tanu and I have co-supervised together, and so I have absolutely tried it several times, and I see the benefits and the challenges of it.
Mm-hmm. So folks, feel free to share yours in the chat. And if you would really, if you feel so inclined, please go ahead and share out loud if you'd like. Yeah, who you are. Tell us a little bit about who's here joining us today.
Yeah, it's always nice to kind of know who you are, where you're at, what you're doing in your role. You know, it's a lot of information to type in the chat. To get an idea of who's sharing the space with us today. Just to know while we're waiting for those to come in.
All right, folks are coming in.
Elizabeth, thank you. Awesome.
Dr. Penniman. All right, thank you. So we can start moving forward as folks share.
Wonderful. Nice to meet you.
So this is our official mini bios. So we're not really going to get too much into this because we did already share about where we're at and what we're currently doing. It is here, however, just as a placeholder, so we can actually talk about what brought us here today to talk about co-supervision. So to give you a little bit of a background, Katie and I did our doctoral work together. And during our doctoral study, we were also clinical supervisors in the practicum clinic on site that we had, in which we supervised our practicum students. And so this is where we decided we would attempt co-supervision. And to be completely honest, it was really for saving time. Like, we were so stretched for time and we just did not have enough time to be able to see all our supervisees, and some of our supervisees were seeing couples, and that created even more of a sticky situation with trying to figure out when we would see them, how we would see each supervisee. And we also had folks who were doing co-counseling. So some of our supervisees were seeing couples together in a pair, which we're also going to get into a little bit later, how that works out. And so we decided we would do co-supervision, and this is where we really got into it with this process. That's just a little bit of background of how we came upon this topic in the first place.
Yeah. And I also want to speak to this because we were really trying to find a co-supervision model of working with co-learners, like very specifically, and we couldn't find anything that was, we even struggled finding co-supervision models within the counseling field. And so we just kind of looked at all the different research that was out there, evidence-based practices related to co-learners, co-supervising, and co-counseling to come up with something.
Exactly right. And that is what we will share today. So you can kind of get a sense of where this idea sort of came from, and also how much of a space there is within the field to develop this further. You want to add anything else here, Kate?
That is it, really.
Okay, so this is our introduction to our co-supervision model for co-learners directing co-counseling. So there's a lot of co-terms here, which we will define in just a moment for you all. This is just to kind of give you a heads up. So why is something like this important for the field? How is it useful? And, in our field, it's often emphasized that supervisors, folks who supervise counselors in training, or that supervision is emphasized for counselors in training, of course. That's what that bullet is about. We do supervision to safeguard our clients. That's number one priority. It's in our code of ethics as well. And that novice practitioners, often folks in practicum seeing clients for the very first time, this is where they're developing their knowledge, their awareness, and their skills successfully. And our hope is to sort of move through with them through this process of learning. And of course, supervision aims to generate these professionals who are proficient in their practice and are actually doing their practice ethically and well. So this model really takes a collaborative approach and uses co-supervisors to help co-learners do co-counseling. And we will break down all of those terms.
So when we talk about co-learning, this includes learners who are not fully skilled and are practicing counselors. So Roller and Nelson actually did write an article about this many years ago. So it is outdated, but it's actually the only information that we found in our search around co-learning in the counseling field. They should not be considered co-counselors according to Roller and Nelson. However, we will be using that term throughout to help make sense of what we're talking about. Rather, they should be just considered co-learners. And then there should be this consideration that co-counseling should be conducted by fully trained practitioners. But Tanu and I saw our practicum students as doing the work. They are going in and they are practicing doing counseling. So we feel like not honoring that can create some, I guess, stigma is not the word that's coming to me, but that's the only term that is like on the tip of my tongue. And then we have co-counseling. It involves 2 or more counselors treating 1 or more clients. A lot of times we know about co-counseling as co-facilitating groups. So you might have more than one person co-facilitating groups. But what we found is having 2 counselors in training working with families or couples really supported the growth of the couple itself and the growth of the counselors working together. And there are absolutely disadvantages and advantages to doing this. It can be really difficult, and we're going to talk more about that. But we're also going to talk about the benefits of this. And then co-supervision involves 2 or more supervisors working with 1 or more co-learners or co-counselors at the same time.
Yes. So really quickly to summarize the distinction between co-learning and co-counseling, because there's so many co-words that can get caught up. Co-learning are those folks who are counselors in training, according to the research that we found, and co-counseling are folks who are post-grad, are already practicing. So that's really the only distinction that separates the 2 terms. However, we will be using the term co-counseling for co-counselors for the sake of today and for how we worked with our CITs. So framework for the model, and as Katie had mentioned earlier, we've also looked at the structured peer group supervision model, which helps when you are working with multiple supervisees. So we felt that this model would frame co-supervision very well. So we sort of think about when we're providing co-supervision, we utilize this framework and come from this space of working with client or working with our students specifically. So, and again, having a framework just helps that we're making sure that things are structured, things are guided, that we're not all over the place, because it's very easy to get all over the place, especially when you have multiple co-counselors or co-learners and multiple clients. So there's a lot going on in the space. So it's really helpful to have a structured format. It's really helpful to have a model to sort of assist your planning as you work with your supervisees.
Yeah, and that the SPGS really helps to structure the co-supervision like Tanu was talking about, but it also encourages collaboration, skill development, and instructive feedback from both the peers, your peers, and from your supervisors. And then it also requires the co-learners to be really engaged in some self-awareness, self-monitoring work.
Mm-hmm. Absolutely. Let's see. I think we pretty much covered most of this. All right, so goals of utilizing this structure, if we're looking strictly at the structure first, at our framework, our model, before we get into how we implemented it with the co-supervision. So goals of SPGS are to ensure that all the co-learners / co-counselors are included in the process of co-supervision, as Katie mentioned, this collaborative piece, because that was very important to us. And then it helps because we're providing attentive and objective feedback, often immediately, whether it's coming from us or the peer that's in the room in the supervision space. And then, of course, we're developing cognitive counseling skills in the process, along with other skills, and improving on the skills that already the co-learners or the co-counselors have. And this approach is really very helpful for groups, as was mentioned before, and especially early on counselors. And it's also helpful for experienced counselors. So when you might have practicum students or counselors in training where one supervisee is a little bit more developmentally in a different space than perhaps another one. And if those folks are paired together, that process of them working together in the group really enhances the supervision. And of course, it provides an agenda. So the folks that you're working with know what to expect, and what they can come into the supervision space with and leave with, so that they know what to do. And of course, educating ways to increase self-awareness and self-monitor, which is ongoing. And I would even go as far as to say that that's hopefully the goal of almost all supervision models, is this process of increasing our self-awareness and being able to monitor ourselves and who we are and how we are in the counseling space as we move further into the practice.
I'm wondering if anyone here has used the Borders structured peer group supervision model and has anything they'd like to add to the goals. Not everyone is aware or knowledgeable about this one.
Had anybody heard of this before? Is this new to you? Is this brand new to anyone? I know, it's a Friday afternoon. I feel you. It is where I am. I don't know if it is where you all are, but
Right.
It is where I am.
Absolutely. All right.
Okay.
So Borders, the creator of the SPGS model, describes it as being relatively simple and straightforward. And when I use it, I would say that that's pretty accurate. And what I love about this is it offers space for the learners to be observing what their colleagues and peers in that space are doing, and it allows them to engage in feedback in a way that's not maybe verbal feedback, but demonstrated feedback, so they can perform the roles that they observe in the video session of their colleague, to provide maybe a different perspective or offer a different intervention that they might have engaged in. And then obviously they have to be prepared to come into an SPGS supervision. They have to have already, figured out what segment of the video they want to show to their peers. So it does require some upfront work. And I think it's really good because we all know, when we observe ourselves doing something, we can recognize where we can make some changes, right? Where we have some growth edges. So they've already started thinking about these growth edges before they go into the supervision, because they've decided on the segment that they want to bring into the space. And they don't have to show growth edges. I mean, it's helpful, but if they want to show something that they are really proud of and get feedback from their colleagues in that way, that can be really beneficial too, right? And get empowering and supportive space for them. And then the co-supervisors can support by facilitating discussion or dialogue around what they have observed. They provide a summary of the feedback that was given from the peers in the space, and they can really facilitate this group dialogue. And then really, I mean, the whole goal of this is to understand if the supervisee got what they needed out of it. So asking for feedback, like, did you get what you needed, or what else can we support you with?
Absolutely. And this was, just to give you all a little bit more background, the clinic that we worked in, we did record our sessions. So our clients that were coming in, it was a free clinic. It was free services provided to the campus community, as well as the larger community where we were. And so folks would come in, they were consenting to the recordings, of course. And so we had recordings of every single session. Often So some of our supervisees were bringing in recordings, and sometimes they were not. So it wasn't every single session, just to kind of give you how we were working, because we unfortunately didn't, again, time is a factor. We understand with supervision, it can be tricky. So there were certain sessions where we did take whatever the supervisee brought in, whether it was something a crisis related that might have happened with a client, or whether it was something immediate that they needed in the moment, so that they can go into the session going forward with their clients, couples, the families. I do want to clarify one other thing. We did not do co-supervision with our CITs who were seeing individual clients. We only did co-supervision with folks who were seeing couples or families. So it was always multiple parties involved. And so that is also a piece of just, just so you all know. And yeah, so can use video. It's super helpful. And I know not every place does have access to that. So that's something to keep in mind, that you are able to do this even without having that segment, because it's whatever the supervisee brings into you, and that's what you go with. So co-supervision, as we've been talking, it has, or at least in our work, we from what we've found, there are specific guidelines for supervisors of co-learners or co-counselors. And these guidelines are really to help support co-supervisors avoid common obstacles or challenges they may come across that inevitably will happen in co-supervision relationships, because you have so many different dynamics, because just by the sheer number of people that are involved, different styles, different models being used, different case conceptualizations happening, different perception of what may have happened in a counseling session, different perceptions of what may have happened in a supervision session. So there's all types of things that are happening that make this dynamic with multiple parties involved more complex than it might be if it was a one-on-one supervision dyad. And so these guidelines, they help sort of tease out some of the challenges you may come across, these multifaceted issues that you might be faced with. And so one of the key issues that was brought up in the research anyway is that we have more than one. However, one that was highlighted is that the way counseling sessions are directed and implemented by different supervisors, which you can imagine, sir, if you supervise very differently than how I might supervise, and now we're going to come together and co-supervise the folks, the co-learners or the co-counselors, how that difference can really show up in that space. Just as that difference can really show up in the space if you have two counselors working together with a client case that's a couple or a family, or even within a group setting.
Yeah. And again, there was just no literature really available in the counseling field, specifically around doctoral students doing co-supervision, but there was literature in the counseling psychology field, social work field, and nursing field. So this is a big part of where we got our information from.
Right. It's been looks at other clinical areas, unfortunately not ours, and maybe we'll do it, but maybe somebody here today will take up that torch.
Great. So we have these, again, we spoke to the one obstacle related to just directing and implementing by different supervisors with different experiences, different worldviews, different theories in which they approach, and different, even different ways of not only understanding the client, but understanding the students, the co-learners, the co-counselors. I think Tanu and I would meet outside and kind of process too. So that really supported moving forward with each of these dyads. But having a learning contract is really important. And it needs to be a collaborative learning contract that, if you're working together with a co-supervisor, you should probably be working with the same idea in mind with the learning contract. You can integrate your different information into it, but it does help to have just one. And then again, the theoretical models.
Oh, Katie, I'm just going to add a little bit to the learning contract.
Please
So
do. Yeah, go for it.
this was actually, so, and again, this might differ for you all where you're at and what this looks like. Perhaps you have a supervision manual, perhaps you don't. I don't, some sites do, some places do not. We were required to have a disclosure statement shared with our supervisees. So that was one of our requirements at our clinic, so that the supervisees knew exactly what the expectations were and how we were going to work with them during the semester, any given semester. So what we did is we sat down and looked at both of our disclosure statements and just came up with one that was combining all of that information so that our co-learners, co-counselors knew what they would be, what they should expect, and what they're getting in supervision when they're working with the two of us, and how that dynamic might look. Because, you know, they knew us in the clinic as, for some of the co-learners, we might even have, I don't think it would be a relationship there. I'm just thinking out loud, because some of the folks we worked with, they were our individual supervisees as well. So it created, again, lots of complexities. So they were very used to working with us one-on-one and just knew our styles very differently in that way. And then when we came together, of course, it looked a little different. So this combined disclosure statement that we offered really gave them expectations, so that it wasn't throwing them for a loop when they were coming into this co-supervision space.
Mhm. Yeah, I don't know why I thought about this though, but I think the really great thing about co-supervising that I know we did was modeling, like how to maybe co-counsel together, because we would really engage in dialogue with the two of us in front of the co-learners as we were sort of processing things happening in the space. So I felt like that was, I don't know, I don't know about you, but I thought that felt really powerful.
Yes, we definitely got good feedback on that. Absolutely.
Yeah. But you know, that willingness to admit that you don't know everything is so important. And in co-supervision. But that's what's wonderful about working with someone else who is supervising, is that they might actually have that information. That can be really helpful. And then, you know, the questions to communicate interest, anticipation of inquiries made by, you know, the co-learners. So that would be part of what we would do before we would go into co-supervision. We would kind of collaborate and have a brief conversation about the session that we had observed, because we were able to observe them through the mirror, two-way mirror, or on the video. So we got lots of opportunities. I feel like that was just a wonderful learning experience for everyone. And we could provide like in the moment supervision if needed, which we didn't typically do that, but every once in a while that was necessary, where we would have to step into the session. And then acknowledgement and support of the co-learners' diligence to learn. So equitable spaces for them to engage, avoidance of that competing, you know, like co-learners can compete. Like, I want to be the best. I want to show that I know everything, you know, because there's that imposter syndrome that can really just punch you right in the teeth, especially when you're being observed by your supervisors. And you have two of them, you know, and then being transparent about your own fears and your own experience as a trainee, that can be really helpful, because as supervisors, I wonder if students go, oh my gosh, they've just always known what they're doing. And I usually say I still don't know all the time, but you know, like, yeah, I remember when I was in training, it was really difficult to, you know, and and then actively listen to their concerns, actively listen to how they both are interpreting what's happening with the clients, how they, I think there has to be some equitable spaces where they both share in the interventions that are being brought into the space, and then open lines of communication, obviously very, very important. And at least one time during the progression of supervision, give each of them their own time to come and speak directly to you about their relationship and co-counseling. And then that just seems pretty significant, because then you're allowing them to give you feedback that maybe they wouldn't give if they were with their partner.
Yeah,
Anything else?
Yeah, I was actually going to add a couple things. So on that last note of being able to have individual space to share whatever they might need to. So just to give you some more perspective as well, the clinic that we were in, we also were there pretty much all the time. That was part of our job. In addition to observing sessions, providing supervision, we were there sort of running our clinic. And so the students, the counselors, co-learners had access to us at a lot of different times outside of just the supervision meeting set. And so they really would, they were able to access us and have that one-on-one individual conversation with either one of us, whoever was available to do that in the moment, whatever they needed. And so, that was I suppose, luxury of being in that space, all the time and being accessible in that way. However, I know that that's not the case for most supervisors. Often you are dedicating that 1 hour, whatever that looks like. So this can require a little bit more. So that's just throwing that out there. However, you're also sharing your time with another individual while you're supervising. So it does lessen the load if you look at it from that perspective. So it's a both and here. So it does require more because you might have two different supervisees talking about the same client and wanting individual conversations. And at the same time, you are sharing that supervision load with your co-supervisor because maybe they don't come to you this time and they came to you last time and you've shared it and they're going to the other supervisor the following week or whatever it might be. So we were able to provide that in that space. So my hope is that if this is something you'd want to try, that you're able to work within your schedule with that. And I know it's hard since time is always flying away from us. The other piece that I'd like to add is also that this is something I mentioned briefly earlier, is the students are bringing in their own strengths. Some are at different developmental levels. So this can also be highlighted as you all are doing supervision together. So say for one example, if our co-learners, co-counselors are working with a couple and one of the students might be very, very interested in working with couples long-term and the other perhaps maybe not be as interested, but this is part of the process and they were assigned these clients. So they work through that. However, that strength that the other student might have of wanting to be in this area of specialty, wanting to work with couples, we use that to the group's advantage, so to speak, and have them really share about, okay, now that you've really wanted this experience, you're getting this experience, how might you support your colleague who might be struggling a little bit? Maybe not this exact language, but something along the lines of having the conversation. Or let's say if you're working with a family and there happens to be a child involved who's a younger child, and you have two co-counselors working with a family with a child involved, and one of them really wants to work with children and has been doing their study on working with children and what that might look like. Perhaps they're getting additional supervision on play. You can bring all of that into the space as well. Maybe the other co-counselor doesn't have all of those other pieces, or maybe doesn't have an interest necessarily working with children long-term. However, now they have access to this information, this different way of working with clients, and just learning more and expanding their perspective and their horizons on what they can do. And who knows, maybe down the road, they might want to see children. However, the point is that having more folks involved just creates more interest, more knowledge, more information, and just expands the experience for the students. At least this is what we witnessed happen.
Yeah. And And something that came up to me while you were talking about that we don't have on here, counter-transference with the co-counselor. Not
Yes.
just with the clients, but with the co-counselor. That was something that we experienced as well. And I, that was, gosh, like it was pre-COVID.
Mhm. Yeah.
But I remember it being something that was, we had to work on outside of that space with the one student and then inside of the space too, because, you've got to be honest and open about your countertransference, especially with your colleagues, so that you can do the work well, so that you can be meeting your clients where you're at and not doing harm. So it can become an ethical consideration as well.
Exactly. That was one of the challenges, and, a challenge that actually helped blossom into great conversations and move forward.
Oh my gosh, yeah. So good.
So before we move forward, any questions, thoughts? I'm going to stop the screen share for a second just so I can and kind of get our group together. Anybody co-supervised? Is this the first time having this conversation? Any feelings so far? So based on the two folks that shared, it looks like we have someone who works in director of professional practice. So you're definitely working with folks who are training, it sounds like, and then clinical supervisors. So you're definitely working with folks who are training either in graduate school or post-grad. So Elizabeth shared, I've only
Yeah.
co-supervised with admin supervisor. Go ahead.
No, that happened. That is typical, where you're not working with someone who is on the same developmental level as you. So you're working with someone who is maybe modeling what supervision would look like. And you're, co-supervising with them. Absolutely. I think that is the more common co-supervision than working with someone who's, your colleague. Thanks for sharing that.
How was that experience for you?
Is it directed at me?
Yes,
Yeah.
yes.
Oh, okay. It's interesting because we do like the split between clinical and administrative supervisor, but if changes occur in the system somewhere and the admin supervisor and I have not talked, then I may not understand how the clinical fits into that admin piece. For example, if something about the documentation changes, and that we didn't have that conversation first, then I don't know the change in expectations for how something is said in the chart or what we're putting in the chart now or what we're taking out. So it does take the supervisor and I needing to speak to each other just so that my clinical piece still fits in with the overall expectations.
Yeah. Yeah, that can be really frustrating when you have miscommunication or a lack of communication.
Right. And then sometimes because the other supervisor, the admin supervisor, is a psychologist, and my supervisee and I are both counselors. Sometimes he comes at things from a psych perspective that doesn't necessarily fit with our counseling perspective. So we have to also make sure that our training also meshes for the supervisee.
Yeah.
Absolutely. That's actually a really good point that you brought up with the clinical notes and that, everything that's going into the documentation is processed with the supervisors. When we were doing this work, we actually did help and support our supervisees with their documentation. So we were going, that was part of it. That was part of it through the whole process is, you know, how well are you writing your notes? Where can we support you with that? How, you know, having that conversation around documentation as well. So again, it was a little different as you are working with somebody with a psychology background, which can create some of these differences and then having to tease those out as you're working with your supervisee. Whereas for us, we were all counselors in that space. So it was just different.
Mhm.
Yeah.
And some of our co-counselors would write the notes together, and then other times they would take turns writing the notes. So that was an interesting thing that would happen.
Right. It was whatever their relationship was as co-counselors, and it would vary. Absolutely.
Yeah. Yeah. Thanks for sharing, Elizabeth.
Okay. Thank you, Elizabeth. I will come back
My
to
pleasure.
our presentation. Yeah. Oops. Here we go. So we have also from Grossman and Cowther, 11 circumstances to prepare for co-supervision. So if you're interested in co-supervision, these are some of the, you know, areas that could be helpful to think about. Some of these we've already talked about a little bit. So let's see. And some of these we might not have gotten into. So supervisors have different expertise, and we can speak on that a little bit. I had background at the time when I came into the clinic of having worked with traditional aged and often non-traditional aged, also college students. I was a college counselor prior to that. So, and a lot of our clients were college students because we were on a college campus. Not everybody, but a lot of them were. And so it helped coming from that area and having that as a background to support my supervisees. Katie had a different background, which she can tell you about.
Yeah. Thanks, Tanu. I had worked in private practice prior to going to UNM to get my doctorate. So I had been doing play therapy. So I was trained in play therapy and have been working with youth and families specifically. And so that was a big part of what I brought into the space, is really recognizing this from, you know, a child-centered kind of lens. But I would say Tanu and I both really understood like intergenerational trauma and how that might show up in, you know, well, not might, it does show up in couples work and family of origin dynamics. So I feel as though a lot of times we were on the same page for most of the co-supervisions, but we both just had different lenses for which we were able to recognize and understand, you know, how I think it was just a little different, and it was, I don't know, that's the only thing I got.
Yeah, I think
so
it worked
unique.
well. It was fun.
Yeah. It was such a unique experience because it was not only was it an educational experience for the students, for me, it was really educational, you
Same.
know? Yeah.
Same. And as we were mentioning, it shared loads among faculty and or clinical supervisors. So this reduces the risk of burnout. You have somebody to process with right there and then, and also outside of the space if you need to. And this can be very helpful if there are, let's say you're working at a clinic that has multiple sites. So, you know, maybe not everybody can be at of course, not everybody can be in every place. So this way you have perhaps one supervisor at one site and you have another one at another site. So there are multiple different formats of doing co-supervision as well. Just like, you know, Elizabeth had mentioned too, it's a different format of doing co-supervision. And of course, if one supervisor has to leave or be on a leave for temporarily or long-term, whatever that might look like, you have another supervisor to support you. It's somebody you've already created rapport with. And someone who can provide supervision in another area of interest, like we mentioned. So we had different area of interest, even beyond our experience as counselors. We had different research that we were doing. We had different areas that we wanted to explore, and we would bring that into the supervision space as well.
Yeah, and our theories, like
Mhm.
I come from a queer theory lens, person-centered, and you know, Tanu got me really focused on Bronfenbrenner's ecological model. I was like, oh my gosh, there's so much here. Yes, we need, and now I actually integrate it into every session I do with people, based on my experience with her in bringing that into the space.
Yeah, I brought in a lot of systems work, brought in a lot of relational cultural model framework, also person-centered. So those are just some of the areas, or some of the theories that I aligned with. So I really brought that into the work. And so we would share a lot. And also it shares it's a type of training for novice supervisors as well. I know that we were in a situation where we were training novice counselors. However, this can certainly be used for folks where you have a co-supervision sort of arrangement with somebody who is attempting to perhaps get their supervision license. It's not a license credential. Certain states require supervision credentials, so it could be really helpful to have this.
Well, and we were actually being supervised as
Yes.
doctoral students who were supervising.
Exactly.
So there's just like layers and layers and layers here.
Yes, we were being supervised at the time. So there were layers, and we were being supervised by multiple faculty. So there's another one. We had a clinical director who was supervising us, and we also had our supervision internship faculty who was supervising us. So we had multiple folks involved as well. So there were layers. Yeah.
There were layers. Yeah.
And of course, just simply pragmatics of having someone else to engage with. Some folks just have an easier way, or like an easier vibe. I don't know if that's the best word, but feeling with others. And so some students just connected more with one of us, and some connected more with the other one. And that was perfectly fine. And they felt more comfortable sharing certain things with one or the other. And we went with the flow of that. Financial motivation, this can be tricky. Maybe Katie can speak on this one.
Yeah. So, when you co-supervise, you typically do share the fee if you're charging a fee for it, but you have less work, and so maybe there's some financial motivation and like, okay, so like, I'm going to be doing less work. I'll be able to share the clinical documentation piece with my person, my colleague. So I'm not doing it all alone. And so to me, that is some financial freedom there, because clinical documentation, reading notes, I don't know about you all, but reading, 40 notes a week and really engaging in them and signing off on them, it's a lot. I would take a pay cut to not have to do that. So that's where I come from with financial motivation.
Yeah, it's just really you have that balance of sort of sharing the load of the work, because it is a lot. And someone to monitor supervisors' behavior. Yeah, if there's something that seems unethical or something funky going on, then you have somebody there to support the supervisee, a different individual. A buffer between the trainee and supervisor if there's someone not getting along, if there's some issues coming up, if there's something going on between a supervisor or supervisee, you have an additional supervisor for support. And a rescuer, which also I know Katie's going to go into.
Yeah, so the rescuer really just helps to support working through any concerns around conceptualization when there's like I guess maybe more around repairs and ruptures. Like that's how I understand that, like coming in and moderating, I guess, or sorry, it is Friday afternoon. Words are there's I guess mediation is might be a better term here. Yeah, so that's how
No, exactly. Thank you. Yeah, that's exactly what the role of the rescuer would be if one supervisor were, mediating the conversation essentially. So these are just 11 circumstances to prepare for co-supervision if you are interested. These are some things to sort of have as food for thought. You do have some limitations in our summary of what we talked about, a little bit of review, and then we can open it up for questions. I know we don't have too much time remaining.
Yeah. So when it comes to, using a co-supervision model, and this is specifically with doing this with novice counselors, in a practicum or internship. So really those green and growing counselors in training. It is so important to understand the complexities of that dynamic. So, I know Tanu and I have talked about the layers and layers of, like the relationships and the people that are involved. So that is just really significant in paying attention to, and not triangulating. Really, because that can happen too, like one supervisee might pull the other supervisor or one supervisor into this, triangle. And then this is not evidence-based. Unless you all know of some evidence around it, our model is not evidence-based, specifically related to co-supervision. But the models that do support it are evidence-based. And it might be rare, this kind of co-supervision, but it is complex. And it is beneficial to recognize the complexities and the multifaceted dynamics and relationships and I guess interventions especially if you're coming from the structured peer group supervision model. And because, Tanu and I did this as doctoral students, there's that whole other dynamic because we were being supervised as supervisors, co-supervising, right? And we did find this approach to be useful. Like we shared throughout our presentation, the benefits that we experienced, we both learn and grew and continue to use some of the things that we got out of our co-supervision together in our current work.
Absolutely. I second that. So questions, comments, thoughts? Thank you, Dr. Crowley.
Yes, thank you. That's not often something, I know that we had never heard of it before, so something new to share with everyone else. Thanks.
Thank you. And it's not evidence-based yet. Perhaps we might do some work around it and it will be one day, but SPGS is. So.
Yes, it is. Absolutely. Yes.
Thank you.
Thank you all for coming on this Friday afternoon.
I know.
At the end of the conference.
Enjoy your weekend.
Yes. Have a great weekend.
Thank you.
Yes, thank you. Yes, thank you.